Here's my video short of the day. It is a follow-up to my MesoBotox. I'm in my car again. We're getting ready for a meeting. Really after only 2 weeks, my pores are almost entirely shut down. My skin looks so much better. My wife has given me the green light, and this should continue to get better in the next couple of weeks. I've found that the time for onset is within 1 to 2 weeks. You start to see some changes, but it really gets better over 4 to 6 weeks. The old thinking for conventional Botox is you do it every 3 months or so until your skin needs less and less. It's really based on the concept that the Botox is working on the presynaptic junction for acetylcholine release at the neuromuscular end plate, which is a mouthful, but that's basically, to me, now understanding how to manage skin, it's a different way of thinking about things. And so I really believe that the treatment doesn't have to follow a 3-month window. And so I talked about onset and durability I've mentioned before. I really believe this lasts months to years, especially when they're stacked. So I now believe that in terms of needing a second treatment or benefiting from a second treatment, it can be anywhere between a month to a year to 2 years, because that interval now becomes a non-issue, since I'm no longer thinking about that 3-month interval for initial Botox therapy, although it's a very convenient interval. So a lot of my patients, I tell them to think about a second treatment somewhere in the 3 to 6 month window range, and then progressively to open that window to be a longer time frame. But now there's no urgency, there's no specific time frame, but that's just to give you some concepts that I've observed in terms of the onset of results, as well as durability, as well as intervals of recommended therapy.